Hi, I'm Kim Da-jung, who presents about Day1 capability for veterinarian. My presentation title is What Can We Do on the Day We Graduate? I want to tell you about our major. Maybe all of you, including me, will be veterinarian from when you pass the national exam and graduate university. But it is hard to say I'm a doctor when the day we graduate because we know very well that we know only little. That's what I want to say. The importance of setting day 1 capability is the subtitle of my presentation. And this is for understanding of standard of what veterinarian must can do. I want to tell you why I choose this topic. Almost students who want to be a clinical veterinarian should be an intern after graduation for a few years, like they know nothing, although we educated for 6 years. We need to set up standards of veterinarian's capability and revise curriculum and improving the system to including the clinical skills evaluation. I'll tell you about background. Capability can be classified into general capability for every workers, expertise capability for veterinarian, day 1 capability, what I can do on the day when I graduate, and year 1 capability that after 1 year getting knowledge and experience. It is impossible to get year 1 capability when I graduate because it is a work that I need experience on. So, day 1 capability for a veterinary student is to get capability to provide veterinary medical service at the same time they graduate. The problem is the nowadays national level of veterinarian education goals is grow up skillful veterinarian who can diagnostic independently. But here is no specific measure. It is impossible to differentiate educational steps and goals. And the real problem is after graduation, it is not possible for a graduate student to diagnose independently. Each student has different ability even though they educated same things for 6 years. They must get additional education to fulfill standard because required capability that shared between university and society is not built up yet. Although Korea and USA treated closed mutual labor of veterinary license, the veterinarian medicinal examination, veterinary education authentication system is not the same. If the Day 1 capability is introduced, we can share standard of exchange programs, clinical practice, and educational content. You may ask, is Day 1 capability only needed to clinical veterinarian? I want to say non-clinical veterinarian is veterinarian too. They need Day 1 capability. At the national level of veterinarian education goal is grow up skillful veterinarian who can diagnose independently. There's no matter who specialty in non-clinical or clinical area. It is all the same veterinarian and they need to get a basic capability. And in fact, the most of the students in the veterinarian fields want to go to clinical specialty. Last reason is the only country that doesn't clinical surgical examination at the veterinarian license test is Korea. The Day 1 capability, the 7th category of clinical skills evaluation. The number 1 is diagnosis disease, number 2 medical request, number 3 anesthesia, pain management, number 4 basic clinical skills for internal medicine, number 5 basic clinical skills for general surgery, number 6 management of emergency case, number 7 is prevention of disease, infectious disease. The other general capability is communication skills, ethics, logical analysis, but it is hard to measure and scoring, and so it is excluded. I'll tell you about number 6, management of emergency case. In this category, the goal is number 1, understand many kinds of dyspnea, treat properly. Number 2, recognize emergency situation and do CPR. The indication we can use is dyspnea, shock, seizure, and conversion. The category 7, prevention of disease, infectious disease, and this is contents about disinfection and disinfectant. The goal is choose proper disinfectant by situation and use disinfectant properly. The indication we can use is before and after surgery. We can use the disinfectant and handling of patients infected by virus, bacteria, and keep clean the hospital. I want to say more specific, but we didn't learn yet, and it will too deep. I just want to introduce what will be studied and what should you know until graduation. I think it is no use to learn something we can't understand 3 years earlier. So I will present again when you can learn this content. Thank you for listening.